Can you
Good
hear me?
afternoon. Yeah,
Hi,
Professor, good
Prof.
afternoon.
Can you see the screen? Can you
Yes,
see this?
Professor.
Okay, thank you.
You're welcome.
Okay, I have those questions that were left the last time. Okay, let's continue practicing question and different topics unless you have something that you want to discuss, okay? I have this question. The client is admitted with pulmonary edema and the MD orders furosemide 40 milligrams IV push. How should the nurse administer the drug? So again, our systematic mm, process to answer question. Do I understand the question? Is about a medication. Which medication? Furosemide. Do I know furosemide? Yes. Majority of us know that furosemide is a diuretic. It's a loop diuretic. It's a potent loop diuretic that, yes, because it's potent and can be administered IV, is used in emergencies because this is an emergency. So I understand that it's about furosemide. But then they are asking me how I admitted the drugs. I don't know what they refers to. So I need to go to the options. So I have the following options. Fast IV push to remove liquid from the lungs as fast as possible. Okay, I understand that. They introduce the liquid very fast. They push very fast in the syringe, the liquid in the vein. Administer only, and we are allergic, okay, to these words, no, those absolute, but could be correct, sometimes correct. No? Administer only if the systolic blood pressure is 100 millimeters of mercury or more. I have doubt in this option. Let's leave an quotation mark there. Administer a slow IV push over 2 minutes to prevent ototoxicity. Ooh. And administer a slow IV push over 5 minutes to prevent nephrotoxicity. So suppose that I were in my Nclex and I were very confused with this question. What I notice here, I have two opposites by strategies, no? A fast IV push and a slow IV push, to a slow IV push, okay? So by strategies, we were supposing that the question is which one is the method of doing IV push of furosemide, fast or slow? And then if it is slow, we have two options. So now that we see here this option that we have the quotation mark, administer only, where we consider that this absolute is unacceptable, because if I have a client with a pulmonary edema, it is a priority. It's the B of ABC. So it's a life or death intervention, the administration of the furosemide. We know that when the lungs are flooded with liquid, the patient can die because we are not fishes. We cannot breathe liquid. So it's important to uh, um, remove the liquid from the lung, because the liquid is in the alveoli, which is something microscopic. The only way of doing that is with medications. We cannot do that with a needle, yes, because we have billions of alveoli in the lungs. And the loop diuretics are the drug of choice to remove the liquid, because they are very potent and are administered IV in a fast way. Okay, so now I say if the patient needs, because has pulmonary edema, the furosemide, and has 99, has 98, even 90, even 80 systolic, I am pretty sure that the doctor will still order the administration of this medication because it's indispensable to save the life of the client. So we can eliminate this option First, because we suspected that since the beginning, because the absolute word, and we have been insisting that those absolute, not always, but in the majority of the cases, in the 99% of the cases, disqualify the option. You cannot deny furosemide to a client because it has 95 systolic, because perfectly you can have this case and is still given the diuretic. So easy to eliminate this option. So now I have in this question the two opposite. Is fast or is slow? Okay, we should know that furosemide has toxicities. So what are the side effects of the furosemide? Okay, the first side effect is that is going to promote the elimination of fluid, no? Elimination of fluid, okay? So too much is called toxicity, no? Too much of something is called toxicity, okay? And too much could produce hypovolemia, yes. Which other side effect you know of the loop diuretic? What alteration produced in the electrolytes? Who can help me to remember that?
Hypokalemia.
The hypokalemia probably is the most important. It's not the only one, but it's the most important. This is another question that you can have in your Nclex, okay? The hypokalemia is important in the loop diuretics, and you know that low potassium can bring cardiac problems in the rhythm, in the muscle contraction, etc. Don't forget that also produce hyponatremia because all diuretics force the elimination of sodium, and with the sodium goes also the chloride, no? So the chloride also is, lowered by the diuretics, the loop diuretic. But generally, it's not the most common question. Generally, the most common topic is the potassium. Is there any other toxicity that belongs to the loop diuretics that is important to know from the
Not that I know.
Ototoxicity, yes.
Ototoxicity.
Yes,
I think
But
it's
yeah,
sir. This is super important and in my experience frequently tested, because remember that the majority of the people that have these heart problems and need as an emergency IV furosemide are old people, and old people are more susceptible to the ototoxicity. You understand? And for that reason, is something to have in mind. So if we have the knowledge, and anyone that is listening that doesn't know that loop diuretics produce ototoxicity, you need to write down now and repeat that 5 times. Loop diuretic produce ototoxicity,
okay.
ototoxicity, ototoxicity, ototoxicity. Yes, 5 times, como en la escuelita. Okay, and of course, you already knew about the potassium, which is very, very important. So now, a drug so potent that has so many influence, is better to give fast or slow? What is your logic?
Slow.
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 Slow. And the main reason to give it slow should be ototoxicity or nephrotoxicity. Ototoxicity. Now the question acquire a clarity for you. Of course, if you had the knowledge, you answer this question very quickly. But remember, we are trying to imagine that we are in the Nclex facing a question that we don't have any idea. And with an adequate elaboration, using the knowledge that we have, we can complete the concept, and we can reach a very educated guess that probably is going to be the correct. So this is the way that I suggest to deal with this question. Another detail that I want to discuss with you for your Nclex related with loop diuretic. Do you know the name of any other loop diuretic?
Torsemide.
Okay,
Futamide.
very important, the one that you mentioned, because in my experience is super frequent, okay, tested, okay, frequently tested, torsemide, and the other one that you said, bumetanide. Okay, so please, it's not always furosemide. Sometimes the question doesn't say furosemide, this is torsemide or bumetanide, and you need to know that it's about the same. It's loop diuretics, and as a consequence, the discussion that we had minutes ago is the same. So one student that go for his anchors can have the question exactly this, but the only change that instead of furosemide says torsemide. And the other one that is sitting at the side instead of torsemide has bumetanide. It's the same question. They're only exploring if you know the family of the diuretic. Okay. Another common question about this topic. Which one do you think is the best way of evaluating the outcome of administering diuretics to a person that has edema? Which is the best way of evaluating in the evaluation if the medication work or not?
The weight.
The weight.
The weight.
Another classical question, the weight. Okay, so the changes of weight that occurs in a short period of time, I say in 1 day, in 2 days, more or less. No, sometimes they say 1 day, sometimes 2 days. Don't be too square mind that need to be necessarily daily. Could be they can present the person that is gaining 4 pounds in 2 days. It's too much. It's too much. No, any weight gain of more than 4 pounds in 1 week is too much. It's too much. It's a person that is retaining fluids. Okay, so it's another common question. And the other question that I seen in Nclex is a calculation question. Is the admission weight of the person is 100, yes, and the next day the weight is 98.5 kilos. Okay, generally in Nclex they don't make you transform pounds into kilos. They generally, I'm saying generally, not always. Yes, okay. Generally they give you the weights in kilos. They don't make you make this division by 2.2. That everybody knows, no? That you divide pounds by 2.2, you get the kilos, no? So they ask you how many milliliters the person, eliminated. How many milliliters you calculate the person eliminated. So how many milliliters?
2.5.
2.5, 2.5, 2.5, ok, 5 más 5,
Little,
10,
little.
llevo 1, 9,
1%.
10 y 11, más 1, 101. So the patient had 101. Mucho cuidadito, take care. Don't commit silly mistakes in the English, okay?
Sorry.
So you are not good in calculation. It was
It's
1.5 kilos,
1.5.
but if I asking you milliliters, you need to say 1500, okay, milliliters. Yes, okay. So don't commit silly mistake of stuff that you know perfectly. Okay, so don't be overconfident. Always double check. Okay, perfect. So this is as far as I remember, the topics that are good to refresh of the related with this question. Diuretics are not related with nephrotoxicity. By the contrary, the loop diuretic, because it's our high ceiling diuretics, are used in renal failure when the doctor wants to push a little liquid out from the kidneys. Okay. Okay. Let's see this question. Client is in isolation for varicella. Varicella is the same as chickenpox, no? Place in order the steps to remove the PPE. Okay, so you finish doing what you were doing, and then you need to remove your PPE. Which one, which infection control a part of standard precaution is varicella?
Airborne.
Can you repeat? I couldn't hear.
Airborne.
Airborne, only airborne, only standard and contact.
Contact.
So
Contact.
it's a standard as everything. Is airborne, which is the most important. Absolutely, this is the most important. But don't forget that also the liquid and the lesions contain the virus and is also requiring contact. Yes. So varicella, the person expel the virus through the breath and is floating in the air of the room, but also the lesions and the liquid in the lesions are continuous. It is something similar with the coronavirus, yes, because the coronavirus is airborne, but is also because can survive in surfaces in fomite for a while, yes. So you need to do both a part of the standard. Flu, influenza is also this dual is droplet, is not airborne, but droplet and contact. No, so there are several diseases that are transmitted through the air, but because the virus survive in surfaces for a while, are also contact. Have that in mind, okay? So now that we know that, let's see if I'm going to remove what I remove first.
Gloves.
Globes, the dirtiest stuff, the globes. Immediately after removing the globes, which of these stuff I remove?
Gown.
The gown. I agree. If somebody disagree, can argue. Okay. Now of the stuff that are left, what do you do next?
Close the door.
Close the door. Why you don't remove your respirator before closing the door?
Because still airborne precautions, so we can
Must,
get it.
you must remove that outside the room.
Mm.
So pay attention to this detail, guys, okay? The respirator in airborne precautions must be removed outside the room because you need to breathe, okay? And then you cannot hold the respiration, okay, while you are in the room. Perfect for, and then, of course, you end usually washing your hands. Okay, everybody is clear with this concept? No problem? Very good. I think there is not too much, okay? If they mention to you shingles, herpes zoster, shingles, which infection control is this a part of a standard?
Airborne and contact as well.
No. Herpes zoster simple. Only shingles is only
Contact.
contact.
It's only
If
contact.
I say
Oh.
generalize or disseminate, so see, I use this word, generalize or disseminated, okay? Herpes zoster, then is contact and airborne. Do you agree? Is clear that, or is any content, any discussion to develop? Is
No.
need of differentiating herpes zoster just without any qualifier versus generalized or disseminated herpes zoster? Do you need clarification? Anyone need clarification? What is the difference?
No, thank you.
You don't need that. Any other person need that? Do you know the difference? Everybody know the difference? Okay, I assume that everybody know the difference. I'm not going to bother you with something, but if you don't know the difference, that's why we are here. Here, the people that are connected here is not to say I know everything. It's just to discuss, to say, well, I don't understand that very well. Can you clarify that? Okay, so everybody understand that there is a difference between herpes zoster and generalized disseminated herpes zoster. The way that I personally understand generalized or disseminated herpes zoster, this is the same as varicella. Okay, herpes zoster is a person that is immune, is a person that already had varicella probably many years ago in his or her childhood, and now has a outbreak, a bout of vesicles in the skin in certain part of the body. And this person, because is immune competent, is not breathing out, is not expelling with the breath the virus, and for that reason doesn't require, okay, airborne precaution. But the lesions, the vesicles, the liquid are contagious. Okay, and for that reason require contact precaution. But
Profesor,
yes,
yo,
why?
yo tomé el examen y lo fallé. Y una pregunta, después yo le voy a mandar lo que recordé del examen.
Okay,
Pero sí recuerdo que una de las preguntas que me salió es que el niño le habían puesto la vacuna y la mamá estaba llamando porque tenía cluster una reacción en la vacuna.
yeah.
¿Qué tenía que hacer? Y las opciones eran no hacer
Cubrir la
nada,
vacuna.
mandarlo a la escuela yo lo que marqué fue ponerle una curita en la vacuna, cubrirle la vacuna.
Cubrirle la vacuna.
Correct, because precisely this is a live virus vaccine. And because it's a live virus vaccine, this attenuated virus could be inappropriate for somebody that is pregnant, but somebody that is immune suppressed,
Yes.
etc. And for that reason, it's important to prevent the dissemination in this case, which is not the most common, but it's a good question. No, this is the rationale of that. Very interesting question. Thank you for. So let me share. She is sharing with me an experience that she had with a question that she saw that is very interesting. Was a child that was vaccinated with the varicella vaccine, and for idiosyncratic reasons made a vesicle and a crust in the site of the vaccination, and they ask what was the best intervention in this case, and they say negative pressure room or etc etc. Simply, when there is a herpes zoster or when there is a local virus of varicella, covering the lesion is enough. The same applies for herpes zoster. A person with herpes zoster not necessarily need to be hospitalized and isolated in a room. If staying in his or her personal room wearing a cloth over the lesion generally is enough to prevent the dissemination of the disease. So covering the lesions is more than enough. So applying a Band-Aid over the lesion produced by the vaccination, it was enough intervention. Very interesting question, okay? Very interesting question. Thank you for sharing and writing down that to share in the future with other students. Thank you very much. Wonderful.
You're welcome.
Well, so everybody know these details of this. What could be the contraindications of the varicella vaccine? What are the contraindications of varicella vaccines?
HIV.
Immune deficiency.
Exactly.
We can include in all this immune deficiency anything, because it can be a person that has a recent transplant that is in immune suppressors, high doses of different immune suppressors, a person with, I don't know, lupus that is having high doses of prednisone, or could be a person with AIDS, AIDS. Okay, immune deficiency. Which other?
Kawasaki disease.
Ya va, chica. You are reading my mind. You are reading my mind. Who are you, cara? Okay, I need somebody say pregnancy. I need somebody say pregnancy because it's more pregnancy. Why pregnancy? Because the mother of the child, the pregnant woman cannot receive
The child.
cannot receive the varicella vaccine during the pregnancy. Yes, because can affect the mother or affect the child, the fetus.
The child.
Because remember, fetuses are immune suppressed, and a live viral vaccine, even being an attenuated, a weakened virus, can be strong enough in a fetus to produce problems. Okay, and that's why it's contraindicated in pregnancy. In pregnancy, we don't administer live viral vaccines. Everybody remember that, yes? And the other one, somebody read my mind, and is that why a child with active Kawasaki, okay, Kawasaki, should not receive this vaccine? Why?
Because receive high dose of aspirin.
Yes, this is the perfect answer. This is the 100 points answer, because those clients usually are treated with high doses of aspirin and usually are children. So children, adolescents, okay, that are in some way having the virus of the varicella or the virus of the influenza, and also are taking aspirin for very complex reason and not very well understood, can develop the Reyes syndrome. Yes, the Reyes syndrome, which is something fatal. So it was also tested. Okay, so patients that are with Kawasaki taking aspirin should not receive the flu vaccine, should not receive the varicella vaccine until the Kawasaki subsides, the aspirin is discontinued, and then they can receive the vaccine. Everybody understood that, yes? In children and adolescents, varicella virus or influenza virus plus aspirin is catastrophic. Reyes syndrome, which is very bad. That's why we teach parents that when their children have fever, never use aspirin. Why? Because we don't know if this fever could be flu, influenza, or varicella. And for that reason, it's better to avoid the aspirin. Perfect. Everybody knows that. Okay, we are good. I think there is nothing that we could, okay, extract from this topic. Let's see this question. Which of the following is most closely aligned with the principles and concepts of informed consent? Okay, everybody know what is informed consent? Is a legal issue. Is required by the Self-Determination Act, which is a law. And the consent is something that needs to be done either implicit or is written. And the informed consent requires, with few exceptions, be 18 or older, required to be in your mental capacities. So you cannot be drunk, you cannot be in coma, you cannot be, I don't know, on the reaction of drugs that alter the mentation. And the most important, the topic that is more frequently tested in Nclex, the patient must be informed. So for a person be allowed by the nurse to sign a informed consent, need to be 18 or older, with the exception that I'm not going to go over this exception because the only that I see in Nclex is a boy with gonorrhea, STDs. This is an exception to that. Okay, boys and girls with gonorrhea, if they are younger than 18, gonorrhea, any STD, can give consent. Okay, there are other situations. I'm not going to this because it's too legal, and this is, I don't see that this is a specific legal. It is a test for nursing, not for the bar of lawyers. Okay, so it's the only interesting that you need to know that if a minor with STD can give consent. It's frequently tested. Why? Why is frequently tested? Because it's frequent. Having minors younger than 18 with STDs is super frequent, for your information, okay? Mental capacity is very important, this detail, at the moment of a nurse giving pre-medication to a person that is going to a procedure or a surgery. You need to verify before giving the pre-medication that frequently include medication that alters the mentation. You need to verify that the consent has been already signed, because if you go to check that, if you realize that after giving the stuff, you screwed up, you committed a mistake and something negligent, okay? And this is the most frequently topic. They evaluate in noisy questions that if you understand that the patient must be properly informed, okay, properly informed to be left allowed to sign the consent. Okay, so a little review of informed consent. Okay, but once that we refresh in our mind, okay, what is informed consent, they're asking, let's see, we understand the question, that what is a line? A line is, is associated, is parallel, is included, etc. Is what means that, no? Alineation, align, okay, with the principle and concept of informed consent. Justice, fidelity, autonomy, non-maleficence. So obviously they are asking about
Autonomy.
Autonomy.
are asking about ethics, no? And remember the ethics in the test, because any profession must have a code of ethics, okay? Okay, so we have justice, fidelity, autonomy, non-maleficence, and the majority agrees that it is autonomy. So the right of self-determination. So yes, a person that is in his or her mental capacity, is adult enough and is informed, has the right of self-determination. So can say yes or not to procedures, etc. Okay, very good. Let's see if there are more questions about ethics. Yeah, I think that yes. Okay, to discuss a little other concepts. What ethical principle below is accurately paired with a way that ethical principle is applied into nursing practice? Okay, the word is say that, paired. It is saying as aligned. Okay, so you're going to have, as I see here, a name and a noun, and then a description on the side. Let's see which one is correct. Justice. Justice. Equally dividing time and resources among your clients. What do you think?
No.
Why no? I don't know. In my test, I put a quotation mark here.
Yeah.
Beneficence. Beneficence. Doing no harm during the course of a nursing care. What do you think?
Yes.
That is good. It's correct. Okay, I want to share you something. Okay, in philosophy, there are two concepts: beneficence and non-maleficence. Okay, beneficence. Okay, so two concepts that are related but are opposite. So in philosophy, and ethics had to do with philosophy, because ethics is not something legal; it's something related with the philosophy and related with the altruism of a profession. And this is the field of the philosophy. In philosophy, beneficence is to do to do
To do.
good. And non-maleficence is maleficency is
No
to
do.
to don't to don't do bad. No, to don't do bad. Yes. And you say, oh, but this is the saying, if I'm good, I'm not bad. And if I'm not bad, I'm good. But it's not true. There is a difference. For example, if you decide to do, let's see, a wound care to a person that has a wound, okay, a bed sore or a burn, and you know that it is going to hurt, but based in evidence, you know that this wound care that you will do will benefit the patient, will be good for the patient, because the patient will heal the wound thanks to this wound care. And then you put in a balance the pros and cons. And then if the pros are more than the cons is the pain, the pros is healing, then you do that. You do. What means to do? Action, no? Or you open your mouth, or you move your hands, or you move your feet. You do something, yes? So you do good. You do something that benefits the patient. But non-maleficent is when you abstain, restrain yourself of doing bad. So if, for example, the funny option that I always use, if the doctor tells you, nurse, I need you to give this cyanide, which is a poison, to my mother-in-law that is hospitalized. Okay, you say, no, doctor, I don't do that. We don't give, poisons to the patients. So what you are doing non-maleficency. What you are doing, you are, not doing bad. You are not acting bad. Yes. So when you take care of not contaminating, for example, the indwelling catheter, the Foley catheter that you are going to introduce, yes? And if accidentally you contaminate this catheter, you take the effort of throwing to the garbage discard or ¿cómo se llama? And going to the stock and find a new cut and start everything again. What is that? It's non-maleficent because you are avoiding to do harm, So it's a very different between doing good, the action, the proactive process of doing good when even it has side effect, even when it has consequences, but the benefits are more than the the side effects, versus not abstaining of doing harm to somebody. So it's a philosophical concept that you need to understand, to be able to deal with questions where you need to decide between beneficence and non-maleficence. I personally had this conundrum, this problem in my LPN Nclex. I had a situation and then gave option A beneficent, option B non-maleficent, and the other were simply to eliminate. So I had to decide between beneficent and non-maleficent in this scenario, and was not easy at that moment to me. Maybe at this moment is a little easier, but not at that moment. So summarizing, beneficent, do act to do good to your client, and non-maleficent, restrain, repress, avoid doing harm, So now that we discussed this concept, beneficence is doing no harm.
No.
Nope.
No.
This is not so I can rule out this based in knowledge, based in knowledge in this discussion that we had. That is very simple. You don't need to write down that, guys. Don't write down. It's something that you need to only to pay attention, and then you say, oh, it's true. There is a difference. And then it's something that you don't need to write down. It's something that stays in your brain forever. Yeah. Okay. Veracity. Fully answering the client's question without withholding of information.
Yes.
What do you think?
Yeah.
So
Yes.
it looks that also is yes. Fidelity. Upholding the American Nurse Association Code of Ethics.
No.
What is fidelity? What is fidelity?
Keeping your promises.
Yes.
Okay, so fidelity, remember that many of us having a relation, no? We know what is fidelity, no? Okay, what we promise, yes? Okay, so it doesn't apply here. The fidelity is related with the clients. Ethically, the fidelity is related with the clients. Fidelity is not related with with an organization like American Nurse Association. Is not related with the doctors. It's not related with the ¿cómo se llama? With the institution, etc. Our fidelity, ethically, as a profession, is with the client. Yes, so it doesn't apply. So it is the most important. Okay, so now I have in my test two quotation mark. It is a common situation in Nclex that you have two answers that look correct, but one is more correct than the other. Sadly, it is a reality in nursing. So we need to think a little, okay? We need to find a defect. We need to find something weak in either one. So justice. Everybody know what is justice. It's fairness. To be fair, no? Is justice. Everybody is born with a sense of justice, unless you are an antisocial personality disorder. The antisocial personality disorder don't have this concept, are not born with those concepts. But if you are a normal person, you know what is fairness. Nevertheless, what is your group of clients? What is your client? You have assigned, six clients usually, no? And you work in a hospital, etc. You have assigned six clients. Okay, my question, do you divide your time equally
No.
in those six clients?
Nope.
Impossible.
Never.
Never. It is totally wrong. It is totally negligent. You cannot divide your resources
And
and
you
your
don't use the same amount of resource with all
exactly.
the patient.
Exactly. If I have a patient with lice, and a patient with sepsis, okay, please, you understand that you cannot use, okay, the same time and the same resources for both patients, but both patient needs attention, but not necessarily using. This is not the real example of injustice. So that's why this option is weak. Uh, I don't find any serious critique for option C, because veracity is to say the truth. And at least theoretically, in this scenario, in this perfect world of the anchors, in this Disney world of the anchors, veracity, to say the truth, is fully answering the client's question without withholding information. Okay, uh, um, it is a very delicate topic, but at least philosophically, and ethically, veracity is this. Veracity is to have the truth all time as a priority. I'm not going to discuss if it is a real world issue. I don't discuss that for Nclex. Nclex is not necessarily everything included, but when we talk about ethics and we talk about philosophy, veracity is to say the truth without any kind of conditioning. The truth is the truth. There are no good truth, bad truth. There are no partial truth and complete truth. There is no, as we say in Spanish, mentiras piadosas or verdades a media. Okay, half truth. This is not truth. Is truth. Okay, that's it. Okay. Any problem? We can move. Yes. Okay. Okay. It continued the ethics issue. It's good to review. Always I see that at least there is one question of ethics in the test of the people, because ethics is a requirement. Legal and ethics is a requirement of a profession. So nurses need to know legality, the legal issues related with the profession, and the questions are very practical, and the ethical principles. Okay, the clients complain of pain 7/10. The client is known to be addicted to opioids. The doctor's orders normal saline IV PRN for pain instead of the morphine. So what is ordering to be, understanding is telling you, nurse, when the clients ask for morphine, give normal saline. This is what says there. The nurse objects, question the doctor's order, based in which of the following principle the nurse decide to question the order: veracity, autonomy, fidelity.
Veracity.
Veracity.
And is not unfair. That a patient that is requesting pain medication, we don't give the pain medication.
Yeah,
And
it's unfair.
and the patient doesn't have the right, okay, to be treated when they have pain, of requesting medication for
Service,
pain.
yeah.
And didn't we promise the clients to do the best for them? So sometimes I don't know you, but sometimes for me, the ethics questions, become complicated because sometimes I overthink. I don't know if it happens to you, but I want to share with you my, wrong areas when I'm dealing for first time with questions sometimes. Sometimes I overthink because what I'm doing is overthinking. Yes. And this is what probably is my problem. You see, it's unfair to deny or to deny morphine to this client that says is in pain, because we agree, everybody here is clear that pain is sacred. Pain is what the patient says. The patient can be laughing, the patient can be I don't know, playing, the patient can be dancing, entiende? The patient can be dancing reggaeton and is telling you that it has pain 10/10 and is dancing reggaeton. I'm so sorry. Independently of your prejudice and your your bias or whatever, you need to accept what the patient says. it is a requirement in this test. It's a requirement in this philosophy that pain is not judged. Pain is not critique, is not placed in doubt, doesn't need verification. Pain is whatever the patient says it is. If the patient said 7 on 10, the patient can be laughing, the patient can be dancing, the patient can be addicted, the patient can be whatever, the worst. You need to accept that the patient is in pain. And not giving medication for pain is not fair, it's unfair. Yes, and patients have the right, okay, to choose pain medication. And theoretically, we promise when we graduate, okay, to do good for our clients, giving pain medication to this pain is beneficent, and but at the same time we promise to do that, no, and it's like fidelity. But I am overthinking. Okay, I'm overthinking because what happens more directly when I tell somebody I'm giving X when in reality I'm giving Y. What I'm doing,
Lying.
You lying.
lie,
That is a veracity,
lie,
yeah.
I'm
But
lying.
just it is so close there.
Yes, but the question is about lying,
Yeah.
and this is my problem. Sometimes I overthink, and this makes sometimes me commit mistakes because if I don't start, complicating the question is very simple. It is a lie. The patient has been said a lie, and when we, do that, it is related with veracity, no matter that any other things apply. So this is what I can share with you of if I were having this question in my English, the probable mistake that I would commit, and I scold myself. Don't look for the for the fifth leg of the cat. Cats only have 4 legs. Okay, so I try all time to overthink them, pretend that I'm intelligent when I'm not. Okay, simply go to the most important when you see this mixture of stuff. The most important here is a lie. Remember that placebo is ethically unacceptable and also legally, unless the patient knows that has the possibility of receiving a placebo. And this is a situation that is found frequently in research. In research, when there are two groups, a group control and a group of intervention, patients can receive either an active substance or a placebo, an inactive substance, a sugar pill that is very similar. And nobody knows, neither the patient, the nurse, or the physician. And this kind of research, the patient needs to sign a consent, need to participate in the research voluntarily, informed, and in his or her mental capacity, so give consent. And in the information, it is said to the client, you could be receiving either a active substance or a sugar pill, a placebo. Do you accept to be randomly assigned to either group? And then the person that accepts participating ¿cómo se llama? In the in the research, okay, is doing that. We agree? Okay. Let me check a moment, guys, because I don't know why receiving. Okay, I know what happened. There is so many emails arriving. Okay, sorry, it is a distraction. Okay. Yeah, finish that. Okay. Okay, another question of ethics. The staff nurse requests
Fidelity.
vacation. Niño, aguántate. Don't read so fast. Don't read so fast.
Sorry, Professor.
Un zapatazo. Okay. The staff nurse requests vacation with 3 months of anticipation, and the nurse manager accepts the request. Okay, trying to imagine that because many of you work. 3 months later, ya tú sacaste pasaje para Cuba. You already have ¿cómo se llama? Your ticket for Cuba, Haiti, or wherever you go. Okay, 3 months later, there is a severe shortage of nursing personnel, but the nurse manager authorizes the nurse vacation, no matter the shortage. Based in which ethical principle the manager decided to allow the nurse living on vacation? Veracity, justice, autonomy, or fidelity?
Fidelity.
Fidelity.
It is a promise. Yes, it is a promise. Yeah, it is a promise. Sometimes students say it's because it should be unfair, okay, that the no supervisor denied the vacation. Okay, it's true, it would be very unfair, but again, it is overthinking because what apply more, fairness or the fact that was promised? And then when they insist arguing with me, say, do you know that you have a partner, no? And okay, suppose that your partner, okay, commit an infidelity. Okay, your partner is cheating on you. So now you have this problem that you know that happens, okay, that hurts a lot at the beginning. Later, it doesn't hurt anymore, but at the beginning, those ambulers are going to hurt a lot, no? So now you have this problem. Do you think that it is unfair or it is infidelity? How you classify that? Unfair? It is unfair. Is that what you did to me is unfair? Or is just infidelity and requires serious consequences? So when I when I use this argument, the discussion stops. So, no, I accept that is problem of fidelity. Okay, just in case. Okay, very good. A new graduate nurse is administering medication. This is your case. You are graduated, you pass the Nclex, you start working in the first days. While observing the nurse, in which situation should the nurse manager intervene? Okay, so somebody is supervising your work, and of course, do I understand the question? What I need to look for, something right or something wrong?
Negative.
Something wrong.
Something wrong.
Something wrong. It's a negative question, okay? Very important, guys. When we are in a rush, and don't be in a rush in the Nclex, okay? So don't be in your Nclex in the rush because, you know, it's a guarantee of committing a mistake. Okay, read carefully. You will have enough time to read carefully. Okay, so what is wrong here? The nurse brings the MAR to the client's room with the drug to give. What do you think about this? Can you enter the medical administration records to the room of the client?
Yes, you can.
Yes.
Yes, we must. We must. So if it is a, you know, an electronic medical record, you have that in a computer that usually is in a card, and you enter the room with your card and your computer, and there you have the MAR, the medical administration record, and then you have a scanner, etc., etc. Yes. And if it's in a facility that only have paper MAR, then you take the page and you enter in the room with the page of the MAR. Why? Because you need to check the medication and the prescription, the order 3 times. 3 times. It is a mandate. When you have an MAR, give medication X, this dose, this route, you need to check this 3 times. You need to check this order in the moment that you retrieve the medication, wherever the medication is stored. Medications are stored in some place, can be many places. I'm not going to discuss the places, but cannot be in your pocket, are stored in a place. When you go to this place to retrieve the medication X that has been ordered, you make the first check. You check your MAR X. You check the storage X. Okay, this is medication X, and this is what is ordered. The dose, and the presentation that is compatible with the route. Okay, perfect. This is the first check. Then you prepare the medication. Maybe the medication is in the vial, and then you need to transfer the medication to a syringe, no, to a syringe. So you prepare the medication, or maybe it's a liquid and you pour the liquid, or maybe it's I don't know, a tablet that is in a common bottle, and then you know, retrieve the tablet, or you pop out the tablet from a bingo card, etc., etc. Yeah, you prepare. Second check. In the moment that you prepare the medication, second check. And the third check is at the bedside. So at the bedside, after you identify the client, which is independent of these three checks, it is not related with the identification of the client. When you identify the client, you do the last check. What medication I'm giving? The medication X. What says the MER? X. So X, X. The dose, and the route, and then you give the medication. So you must enter the room with the MER. Okay, so it is a reinforcement because I saw the question of the how many times you need to check, okay, the order or the MER before giving a medication 3 times. I see this question. I see question in which this understanding that is basic nursing need to be very clear. Okay, so we can eliminate this because this is correct, and I agree with that. Okay, the nurse asked the client to state first and last name before giving the drug. What do you think about this?
She need to question another birthday.
But that one is
Oh,
okay. That one is okay.
Date of birth.
okay,
No,
so it could be
Need another,
name,
okay,
first name.
okay,
It's
or
one
you need
question.
another identifier.
Yeah.
So I'm not sure. So what I do in my test, I put the quotation mark here. Yes. So for some of us it's okay. For others is not complete. Let's see.
Not complete.
So let's continue. The nurse doesn't wear gloves to administer an antibiotic. Usually antibiotics a cycle a year, no, to
Yeah.
hepatitis B client. It is correct or incorrect?
Is correct.
It's correct.
It's correct.
You don't need
Everybody
to.
agrees?
Yes.
What kind of infection control is hepatitis B?
Standard.
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 Standard precaution. And for standard precaution, unless you are touching body fluids, mucosa, or open skin, you don't need to wear gloves. To give a medication to a patient that is the tablet, you don't need to wear gloves. So only wash your hand before and after, okay, interacting with this patient. So this is correct. Okay, take care. Many people think that in a standard precaution, hepatitis B, hepatitis C, and HIV are standard precaution. And unless you are going to touch the body fluid, blood, urine, whatever, the mucosa, the mouth, the anus, or the whatever mucosa, or ahí se me olvidó, body fluids, open skin breakdown, wounds, rashes, etc., you don't need to wear gloves. So you don't need to wear gloves to check the pulse of a person with hepatitis B or HIV. You don't need to wear gloves to touch a client, to auscultate a client with HIV. You don't need to wear gloves to give a tablet to a client with HIV. Make sense? So it is correct. The nurse doesn't check blood pressure before administering digoxin. Is this correct?
Yes.
Yes.
You don't need to take blood pressure. Pulse.
Correct. You need to check the heart rate through apical pulse. Yes?
Yes.
So it is correct. So then it looks like the lady that found an objection in this is correct. Why? Because she's saying first and last name, I mean John Smith, is not enough because there are many John Smith in the world. And Juan Pérez and Maria Fernandez. Yes? So first and last name is one identifier. And we need at least
Exactly.
2 unique identifier. So name and last name, okay, is one
Date of birth.
identifier.
Yeah.
And then you need to use a second unique identifier. So it can be the date of birth, which is the most commonly used, could be the number of registration in the facility, this number that is given in the the chart. Could be could be the social security number, could be many options, but usually is the date of birth. Yeah. So please don't commit mistake in a question like this in English. Now I want your opinion. Suppose that you are the people that are in the Nclex and they give value to the questions. No, so each question will have a different value. It's different. It's different from the school. That usually the question have the same value. In English, each question have a different value, and answering the question give you point. Failing the question subtract point. So you're going to have like the market, no, just the economic market. You have ups and downs, ups and downs. When you answer a question, you go up. When you fail a question, you go down. Depending on the value of the question, okay, you can answer a question that is very difficult, they give you a lot of points. Then you fail a question that is less important, they take you little points. You understand? So now you are in this head. So there is a moment in which the program, the software, okay, in this up and down, reach a threshold that they say the guy have enough knowledge, is passing. Or there is a threshold when they
It's
say
not enough.
the guy is lost, need to study a little more. Yes? So this is the way that the software works. Okay, now, if you fail a question of safety so important as identification of the client, they are going to subtract points. But what is your opinion? They are going to subtract a lot of points or just a few points?
A lot.
A lot.
So if failing this question, this stupid question, okay, in my opinion, could make you fail. Only one question, fail your English. Because the amount of points that they will subtract from you, something so serious, that affects us. What is thinking the people that give you license? This person is not safe. This person is not even able to properly identify the client. So I hope that this experience, okay, with this question, okay, make you very careful with any question that had to do with safety. Yeah, because the test is basically looking to see not so much if you are knowledgeable, but if you are safe. Because they accept that you are rookie, you are new graduate. They accept that you are ignorant, but they need you to have the minimum knowledge to be safe. And you need to demonstrate your first minimum knowledge, like this discussion that we are having, and second, common sense. Okay, so a part of your knowledge is that you have a minimum knowledge and common sense. In relation of the knowledge, remember that this is an entry level generalist nursing. Sometimes I am concerned because sometimes we overload you with specialties, acute ICU environments, etc. And this is not the most important for Nclex. The important for Nclex is the basic nursing, is infection control. If you are aware of, the basic needs of the clients in all the aspects, and especially if you can identify those situations in which you need to ask for help. Like, for example, when you see a VTAC, or when you see somebody that is cyanotic, or when you see somebody that has a compartment syndrome, or when you see somebody, I don't know, help me, when you have any ABC situation, if you understand that it is a life-threatening condition, that not necessarily is yourself the one that is going to save the client, even if there are some first aid that you can give, are very logical, but if you are able to ask for help, and it's very important. So please take an experience. If any one of you had problem with this question, take a little experience in the safety question. That identification of the clients is something basic in safety. Okay, it is a message because I believe in that. Because sometimes people pass, sometimes people fail and they don't understand what they failed. One question can make you fail. I think so. This is my opinion. I'm not sure of that, but it's my opinion. Okay, let's continue.
I have a question before you move on.
Yes, I'm here.
In ITI, there was a question similar to that one, but they were saying that one of the identifications, it was the phone number. And that was never clear to me. A phone number is a form of a...
It's acceptable. It's acceptable.
Oh, okay,
It's unique. It's very unique. My phone number is different from yours.
Yeah, but it changed. Like people change phone numbers a lot. Could be.
Yes, but it's overthinking. Okay, it's overthinking. Mine has not changed. You understand? So it is a possibility. You know? I don't think that it's going to be this way in your ankle. What I think in English that the question is so straightforward, that or you don't know. Yeah, like como esta, like this. That is straightforward. Or you know or you don't know that you don't need to wear gloves to give a cyclovir to a patient with hepatitis B. And you need to know that you don't need to check blood pressure. Instead, apical pulse, heart rate for giving diuresis. You know or you don't know. It's straightforward. These vericuetos, these filigram that sometimes you see in our Vallin test, in ATI test, etc., are not necessarily the way that anchors made the questions. In my experience, they are very, very fair question and very straight. Majority of people that study and go to well prepared to the anchors feel very comfortable in anchors. And even if nursing is very difficult because nursing is infinite, but they consider the opinion of the people that study, go to the anchor studying, being well prepared as you are going to go, feel that the test is fair. Is much more fair than Vallin's test or the ATI test, etc. So don't be afraid of the anchors. I think that you will enjoy anchors. What is doing ATI? What is doing Vallin? Overtraining you. Okay, overtraining means what they do with the athletes. When the athletes are going to compete and they really want to win, they don't train the minimum. They train more than they needed. Okay, just to increase the possibilities of being successful, especially in high performance competencies. And for example, they bring them to altitudes, okay, to train where the concentration of oxygen is lower than usual, than the place that are going to compete, etc., etc. So it is a strategy. It's the same strategy at the moment of preparing you for this competence, for the anchors. So don't be sad sometimes when you don't do well practicing ATI or HESI or whatever, because this is the purpose of overtraining you. And precisely because you are overtrained, you are going to be doing very well in anchors. This is the philosophy of this hard type of test that sometimes you have. But then when you go there, you compare that. ¿Qué más, Vallin? Sí, yeah, basically is something that I like to share because, and don't be frustrated when you fail a question. You don't learn when you know the answer. You learn when you fail the question. I mean here, practicing question. Because precisely, if you know the answer, you're losing your time, okay? Why to practice question that I know the answer? I need to go to the question that I don't know the answer. So the most important when you are practicing question, preparing for any test, is when you fail the question. Because now you are learning. Because you didn't have the knowledge or you have a wrong knowledge, and then you are correcting the knowledge. Okay, yeah, that's it. A 3-year-old client with a heart defect is prescribed a dose of furosemide. To correctly identify the clients, the nurse should check the armband and Look at the bedside chart. Request the parent to state the client's name. Have the child state his name. Have the child tell when his birthday is. What do you think is the best answer of this?
Request the parent to say the child
So
name.
it's the same scenario. That's why I didn't, too much. It's the same scenario. We need two unique identifiers. Okay. So in this case, what is the problem? They are giving the age of the client. So what we need to learn of Nclex question and nursing question, when they give the age, is important because you cannot consider dependable on reliable a 3 years old reports can be influenced by your presence, etc. So it's important that you are not committing mistakes. Okay, the moment identifying the client that is 3 years old based in what the patient is saying because it's not reliable because the age. And in this case, you need to depend basically on the information in the armband plus the information of the parents. Okay, checking the bedside chart is not identifying the client, is identifying the chart. You cannot depend in the child. Okay, saying that, or unless the date of birth. Notice that both name and birthday are unique identifiers, but in the two options are given by the child. So by strategies, your logic say, okay, name is okay, birthday is okay, but is given by the child. So obviously they are making me understand that the information given by the child is not reliable because the age of the child. So I need to discard these two options, and this is stupid. So obviously it is not practicing because sometimes we have a bad day and we don't have clear the answer, and we can use certain strategies to to clarify the situation. More topics of legal, etc. Select the legal term that is accurately paired with its description. So I have 4 nouns and the description. Assault, touching a person without their consent. What do you think about this?
No, it's wrong.
No.
No.
No. What is this definition?
Battery.
Battery.
Just
That's a
battery.
battery.
This is the battery. Okay. This is the definition of battery. So when you do CPR, chest compressions, to a client that is DNR, it is battery because you're touching the person without the patient consent. When a surgeon do surgery in a person without being signed the consent, the informed consent, the paper, it is battery. When you check the blood pressure of a client and you put the cuff without telling them first that you are going to check the blood pressure and the person extend the arm, it is battery. Okay, so not necessarily is beating a person, not necessarily is slapping a person. Of course, this is aggravated battery, but touching a person without the client's consent, in this case, is battery, and it is not paired. So this is not good. Of course, they're here, defining battery, threatening to touch a person without, okay, the consent. So what is the difference between touching and threatening? Okay, this is actually touching, and this is just a threat. Okay,
But
so
this is incorrect too.
this is incorrect true. So because this is the definition of what?
Of the assault.
Assault.
So
Assault.
the definitions are crossed. Yes, the definitions are crossed. Suppose that you are like me, because I'm a person that easily get confused. Okay, and you have problem in the test. If you have a similar situation, think in a bat. Those bats that use people to play baseball. Yes. And you take the bat and you beat somebody with the bat, okay? Trying to imagine that, okay? Trying to imagine that you're beating somebody with the bat, okay? If you do that, it's a battery, okay? Battery, okay? So it's a way of knowing. If this is touching somebody with a bat, then threatening, okay, to touch a person, okay, could be assault. So if I tell the client, if you don't take this tablet that I'm giving you and you insist in not taking the tablet, I'm going to tell the doctor to order a tube that I'm going to pass through your nose until your stomach to give the tablet through the tube. What is that?
That's threatening. Right?
So,
It's threatening. It's an assault. Okay, so it is an assault. Yes. Okay. If I tell the client, if you don't take the medication, or if you don't shower, I won't give you food. This is also an assault, even if no, if no, I'm not going to touch necessarily the client. It is also an assault. So when you do this kind of stuff that frequently are done in the real life, especially here in the city nearest to United States, ¿cómo se llama? It is assault. Okay, so it is frequently tested, guys. Okay, it is frequently tested. Okay, slander, false oral defamatory statements.
yes.
And slander, false written defamatory statements. Okay, so what one is the right definition of slander?
Sí.
False oral.
Sí.
Is oral.
Sí.
Is oral. Okay, because the written is, how is called the written?
Libel.
Libel. Okay, so again, I had this problem differentiating libel from slander. Okay, so when was written, I thought in a book, in letters. Okay, okay, and for that reason, okay, written letters, okay, libel, LL, okay, and oral is more speech, slander, speech, okay, libel, something that is a letter, written, okay. The nurse cares for a client on hemodialysis from chronic renal failure. After several months of hemodialysis, the client declines to continue with the treatment. It is most, here, well, in English, you can have highlighted the qualifiers. It is most important for the nurse to take which action. So please first trying to understand the question. It's a question of prioritization. When you have first, most important, next, etc. Okay, it is a prioritization. Okay, and in this case, it's a prioritization of significance, of importance. So you need to find the most important. What means that probably in the options you are going to see several options that are correct, but one is more important than the other. So let's see what is the most important in this scenario. A person that decided to stop the hemodialysis. Ask the client's family to encourage the client to change, his or her mind. It is correct, guys. It could be correct. Ask another client undergoing dialysis to talk to the client. It is correct. Yes. I don't see that is incorrect.
No, it's correct.
Record in the chart the client's decision. It is correct.
It's correct too.
Inform the clients about the eventual results of refusing cures, and this is correct. Okay, of these four correct, which one is the most correct?
D.
D.
Of course. D as in diamond. Why? Because the client can refuse treatment based in the ethical principle of autonomy and the legal principle of self-determination act. Yes, self-determination Act and autonomy. We agreed about this previously. But what is a requirement of being able to give consent or refusal, what is necessary for autonomy is be informed. Yes, being informed. And here is when you see why this is the most important. How a person could take this so significant, so important decision without having the information of what is going to happen after the dialysis is stopped. Yes, so this is the most important, much more important than documentation, more important than the peer influence, more important than the resource of the influence of the family, the support system, etc., etc. Make sense? Good, 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 good. So remember, those words are very important to understand the question, because take care. All the options could be right, or at least 2 or 3 options could be right. A client is going to have a mastectomy and is brought to the on-call area where it's received by the circulating nurse. Okay, so trying to visualize, you need to have a little imagination when you are in your ankles. You need to close your eyes and see what is happening. The client is going to have a mastectomy. It's a serious surgery, a very serious surgery, because mastectomy is mutilating and it's obviously a cancer, no? So it would be life-saving. So it's serious surgery. And the client is brought in a stretcher, okay, in a stretcher, from where the client is in the service. The client is brought to the OR area. This on-call area is just immediate before the OR, where is received by the circulating nurse that receives the client. Yes, this is the scenario. Very good. The nurse realized, the circulating nurse realized or discovered that the consent has not been signed for the surgery. What should the nurse do first? Again, we have here a word that in this case has not been highlighted, but you need to immediately identify. If you see first, it is a prioritization question. Guys, you know that you have a booklet called La Charity that trained you in question of prioritization and delegation. And this booklet is very good, okay? You have that in your bookshelf, and you can if you still have access to your bookshelf, you can download all those books and keep those books for you. Okay, so this is a question of prioritization, but when they use the word first, it's a chronological prioritization. Yes, so you know that there are a chronology in your actions. If you go to a party, for example, and you want to dress for a party, you need to shower, you need to dress, you need to apply a perfume, etc. What you do first, you dress or you shower. So there is a prioritization that is chronological. Yes, so the same is in the question. You need to make a chronological prioritization. So when this nurse discovers that the consent has not been signed, what is the first that this nurse must do?
Could it be C?
Sí.
Determine if the person is in condition to.
Okay, some people are favoring C. Is there any other option?
D.
Because
D, the last one.
Sí.
D as in David. Okay.
David.
Okay, D as in diamond. Okay. Okay. So makes sense. So now in your Nclex, you are between this and this. So it's healthy to make compete the options. Okay, is healthy, absolutely healthy. I think that is healthy that the group is between C and D, because obviously the anesthesiologist usually know the issue here. It is an independent consent, and it is, let's leave that hanging there, okay? So suppose that you are in your Nclex. Suppose that you are in your Nclex and you have a question and you are not sure or what is the answer. Could be C, could be D, and could be. So now I can continue with the imagination. Suppose that you are the doctor. You are the doctor, and I am the nurse. Okay, so I'm coming to you. Doctor, the patient has no, that you are going to have to do the mastectomy has not signed the consent. What you answer to me?
Try to resolve the problem.
Find someone who can sign.
No, the doctor is going to tell me, make the client sign the consent. It's just a second. I already talked to her. She wants the mastectomy. She gave me the verbal consent. I explained everything to her and her husband or whoever, and they agree with the surgery. Please make the client sign the consent, please.
And what if
Doctor,
she's
doctor,
addicted?
and what if the patient has already taken medication that alter her mentation? Legally, she cannot sign the consent if they take the medication. Well, find out if she had or not a medication. Don't you think there is a logical answer the doctor will answer, or will give the nurse if you say that to the doctor? Because you decided to go first to the doctor, and now the doctor is telling you. Okay, so what you need to go? You need to go and the chart and find out if the patient received a medication that could alter. So the options are yes or not. Option yes, receive the medication, cannot sign. Option no, didn't receive any medication that altered her mind, can sign the consent. Do you agree or don't agree?
Yes. Yes.
Everybody's agreeing, no comment.
Yes.
Okay,
Yes.
suppose that the client received the medication. So I'm coming back to the doctor. Doctor, the patient received, I don't know, morphine, received, ¿cómo se llama? Diazepam, lorazepam, Xanax, and everything together. Okay. Mija, mijo, go and find if there is any person authorized to sign for her in case that she is incompetent. Find if she has a proxy, you know? And I'm going to see. So suppose that the patient receives that, then you need to find a proxy. Yeah. So suppose that the lady is single, has no children, has no family. Doctor, no, she has no any proxy assigned. There is no family member. Nobody is her proxy. Entonces, now the doctor, well, we're screwed up. We need to cancel the surgery. So do you realize the scenario that you can imagine, because you have the capacity of that at the moment of having a question like this, you can have the capacity, if you dedicate a little while to the question and you relax, you cannot be so nervous in the test. It's important. That's why I want to decrease the anxiety. It's just first, it's just a test. It's not your life or the death. It's not that they are going to deport back to your country. It's not it's not that they are going to kill you. It's something, it's just a test. Yes. Life is more complicated than this. And second, it's a test that you can pass if you prepare well. Yeah. And it's just a test. Okay. So I don't want you to be too nervous in the test, because anxiety is not going extreme anxiety. Mild anxiety is good, but not extreme anxiety as some of you develop in the test. So you need to enjoy the test. You need to enjoy this question. This is a question that you can make funny. Okay. You can make fun of this question, and you can dedicate a little time, because this question is a little more complicated, to imagine this scenario that I just represented. Okay, so obviously next time that you have a question like this, don't use the conditioning. Okay, I don't know if I'm talking about conditioning with you, but you know the perrito de Pavlov, not Pavlov dog. Okay, that when you ring the bell, the poor dog started, drooling and salivating and producing gastric juice. The conditioning that you have from practicing question and from the school and from previous tests, that when you have a problem of signature of the consent, you go directly to the doctor. Notice that you can do a lot of independent interventions before going to the doctor. So first, you need to do C. If C tells you that the patient is unable to sign because is already sedated, is already out of her mind, then you need to go to 2, because 2 proxy can give consent. And just if both fail is when you go to the doctor. So the option doctor, surgeon, is the last in this question. In this question. Maybe in another question, they don't give you the options of doing independent nursing intervention. No sé si yo tengo alguna por aquí. No, I don't have any other. Okay, let me represent a question now. Okay, I'm going to do another question. I don't have that question here, but I'm going to give you the question. A woman is brought to the med-surg service to have an hysterectomy. Hysterectomy. Okay, what is this?
It's a major surgery.
Okay, what they remove?
Womb.
Uterus.
Uterus.
The womb, the uterus, okay? If they say oophorectomy.
Fallopian tube.
No.
Ovario.
Ovario, yes. Yes.
If they say salpingectomy,
Trompas.
okay, so please have that just in case, because somebody told me that he had a question, they say oophorectomy in a 35 years old woman. What was the consequence that the nurse expected to develop this client after this surgery, after total oophorectomy? Of course, the answer is premature menopause. Yes. So symptoms of premature menopause, no? Surgical castration produce premature autumn. So now my mind flight of ideas called that. Now you see that in patient with maniac and sometimes in psychotics patient. Okay, but okay, but I think it's good to when I remember question to discuss, no matter it's a flight of ideas. I'm going back. The woman is admitted for a hysterectomy. Okay, and when the nurse brings the informed consent to sign, okay, the client states, yes, I will sign the consent because I want to have this surgery and being able to have more children. So what do you realize with this statement?
She doesn't know.
She doesn't know. So she's not informed.
Informed.
So the options are now olvidé el problema, acordarme las opciones. The options were do you know what is a hysterectomy? This was an option. The other option, do you know what is a hysterectomy? The other option, give the consent to sign, because she's saying that yes, she was to sign. Give the consent to sign. Allow the patient to sign the consent. The other option, explain that after a hysterectomy, she cannot have babies.
And call the doctor for more information.
And now ahí en it, but that's why I'm bringing the question. You understand that to make you understand that sometimes this is the answer and sometimes it's not the answer. Okay, so I always, when I explain that in Nclex and in nurse in questions is like the music. If they play, I don't know, salsa, you dance salsa. If they play bolero, you dance bolero. If they play, I don't know, rock, you dance rock. So you need to dance with the music they are playing. That's why it's so important to read carefully the question, because not always is the stereotype, is the repetitive answer. And then the answer is don't sign, let me call the physician. Of course, this is the correct answer, because you are not supposed to give technical information about the surgery to the clients. This is not in your scope of practice. You can give information about nursing care, but not technical, information of the procedure. This information must be given by the provider, by the person that is doing the procedure. So in this case, definitively the right answer is the classical answer. Don't sign and let me call the doctor so he talks to you.
It's like you say, always is a win-win. You say the truth and you call the doctor.
Exactly. But so it depends. It depends of the question. So in this question, it's called the doctor, but in this question, it's not called the doctor.
Not to call. Yeah.
Exactly. So it depends. So acuérdate, pay attention what music they are playing. The orchestra is playing to decide what to sign. Moral. Okay, we need to read carefully the questions in English. Any rush, any anxiety, unnecessary anxiety is against us. When you have too much anxiety, when you hate the test, when you have a question, you want to get rid of the question as soon as possible. So you have this question, you hate this question, you are suffering. You are suffering in the test because you have a lot of anxiety, because you are giving more importance than they needed to the test, etc., etc. And then your level of anxiety gives you the need of quickly answering the question. And the first thought that sounds informed, click next. Now you feel a relief, you feel a pleasure, because now the question is not in front of you anymore. This is psychologically negative. It goes against your possibility of being successful in a test. Is not logical, doesn't make sense to have a level of anxiety in a test that you are suffering during the test. You should learn to enjoy the test. I don't know if you got me, because I try to make even fun making a scenario of this question. And yes, you can briefly, but quickly, mentally, you can close your eyes and trying to imagine, the scenario. Okay. So please don't rush and don't go too anxious to the test, because it doesn't make sense unless you want to repeat the test and you want to pay, I don't know what is charging now, 300, I don't know, many times. Okay, next. The client tells the nurse his or her desire of being do not resuscitate. Okay, it is also included in the Self-Determination Act. Of course, it requires to be adult, to be in his or her mental capacity, and being informed. The person needs to know what is DNR. Always be sure that the patient knows what means DNR. Nurse, I want to be DNR. Okay, ask me, what do you understand for DNR? No, I don't know what is DNR, but my neighbor says, she say that it's DNR, and sometimes, carrying a medal that say DNR. I want to be like her. Or maybe no, my nephew, that is the one that is going to inherit me. Okay, my money is going to be inherited by my nephew. He said that I should be DNR. I don't know what is that, but he told me that to ask you to be DNR. Do you understand? So it's important. I don't know if I'm explaining myself, but it's important, okay, to assess, okay, the understanding of the client to be DNR. So assume that because it's not included in the options, the client knows what is DNR. And the question is, what you should, let me see. Okay, see, the question is about understanding. What should the nurse do first? What you do first? Look at the option, because I explained the question before presenting.
Clarify the client's understanding.
See, yeah.
So it's clear, no? It's clear what I told you to understand. So in this case, in this question, okay, the correct answer is to clarify the client's understanding of the DNR condition. And the next, suppose the patient has clear understanding. The next, what is going to be?
Inform the provider.
Yes. Because do you know that DNR is a doctor's order? Is something that is not automatic, need to be signed by the doctor. You
And
know?
the nurse is only the witness.
But the nurse doesn't sign there.
No, no.
Doesn't sign anything. The only signature of the nurse is in the informed consent. Okay. Okay. So it's important that you remember that it is a doctor's order. So the doctor immediately need to be informed because need to order the DNR condition. Very good. Very good. Okay. Which client is best served by a case manager? It is another topic that is in Nclex, okay? Case management. Case management is something that tries to obtain several benefits. Benefit number one, and probably the most important, the one that I had in my Nclex and was the answer: reduce cost. America is the country, so United States is the country that expend more money in healthcare than any country in the world. First, second, and third world. And not necessarily is the most efficient, okay, healthcare system. Is very advanced in research, is the tip of the pyramid. And in research, so the centers of research are the best, and the knowledge, okay, arises from here. But the base of the pyramid is not very efficient, and there is a lot of loss of money as a consequence of this problem of management. So this is the main reason of the managed care. The second is to decrease fragmentation of the care. Why the fragmentation of the care? Because the team is not working. The concept of teamwork is not going on. Team is, for example, when a person has, let's see, pulmonary edema, heart failure, has a chronic cardiopathy and has heart failure, presents a pulmonary edema, calls 911. So 911, the medical technicians give a first aid and transfer the client to the ER. In the ER, the client is seen by the doctors of the ER, the specialist of the ER. The doctors administer the first aid medication, but then requires the consultation of the cardiologist. So the cardiologist comes in, give opinion, order test, add medication, but then the cardiologist suspects that the patient, a part of the heart problem, has a COPD or has a pulmonary infections and requires the consultation of the pulmonologist. Then the pulmonologist comes and gives the opinion, give more medication, give more tests, and then the pulmonologist notices that the patient is a little altermentation. So say, oh, maybe this patient is having a problem, psychiatric problems, and call the psychiatrist. The psychiatrist comes and evaluates the patient and think, no, this is not psychiatric problems, this is an organic problems. Let's call the neurologist. And the neurologist come, and I'm repeating this, and the neurologist say, oh yes, there is a mini stroke. This is a patient that needs rehabilitation called physical therapist. And then physical therapist, and also called the dietitian. And then at the end, there is a lot of people participating there and charging and ordering tests and charging and ordering tests, and they don't communicate between them. The case manager is the liaison, is the link between all this person, because this case manager is assigned this client, and the case manager will communicate with all the members of the team and is going to integrate the interaction of the team, not necessarily actually in the same place at the same time, but communicated between them. So this fragmentation is one of the aspects that is targeting the managed care. 3 is continuation of the care. What is the problem of this patient? Well, this patient is going to be treated very well in the hospital with huge cost. This is going to cost a lot to Medicare. Probably the patient has Medicare and maybe also Medicaid. So it's going to cost a lot, not to the client, but to you, to the one that is going to pay taxes, because you are going to pay taxes when you start making money. And then the patient is finally leaving the hospital in very good conditions and go for home. But once in home, there is a lot of failure in continuing the care of this client. This client needs to continue because a chronic condition needs to continue the care. Because if the client is not continuing the teaching, continuing the care, continuing the follow-up, the appointment, the transportation, the medication, teaching, blah, 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 then what is going to happen? The patient is going to decompensate again, and is going to develop pulmonary edema, and is going to start the story again. Yes? And of course, the last is the satisfaction of everybody, especially the client. Increase the client, okay? Increase the client satisfaction for the care, and increase the satisfaction of us, the people that work in the environment, are the 4 main purposes of managed care. And the best professional that can be a case manager is a registered nurse, because the registered nurse speaks all the languages that speak all the members of the multidisciplinary team, and can see the patient like a holistic approach. Okay, that's why managed care and roles of case managers are frequently present in your Nclex. But it's not difficult when you understand that. If you understand, okay, what is this, then you can deal with the question. Of course, the type of client that needs a case manager and managed care is not the patient that has a cystitis, the girl that has a cystitis. It's not the patient that has a fracture, because you have a fracture, you get a cast or the surgery, and then 1 week of rehab, and then that's the problem is solved. Are the chronic conditions? The patients in dialysis, the patient with diabetes, the patient with heart failure, the patient with chronic condition. Yes. And especially chronic condition that ends in the hospital, expending a lot of money, okay, for the society. So the question now say, of these 4 diseases, which one is best served by a case manager? So now you have here an older woman with chronic cystitis. So, okay, it's a chronic cystitis, okay, but it's just a cystitis, guys. Then you have somebody with hypertension, but well controlled with beta blockers. You have an older woman with chronic heart failure and diabetes. And you have a man that ankles. So which one do you think is going to spend the most money, is going to require the most chronic? C. Of course. So now, if you have the question that I had of managed care, it is to reduce cost. What is the main purpose? Blah, 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 reduce cost. Other are being, presented cellular applied. Okay, and remember that the case manager is not providing direct nursing care. It's not giving tablets, not changing diapers. It's just managing the case. Okay, this is more or less what is managed care and case manager, so you have an idea if you have a question like this, how to deal with this question. This is another topic. You don't need to get 100 in the test to pass. Okay, you only need to demonstrate your minimum knowledge. Okay, your minimum entry level general knowledge. The fact that you fail a question like this is not going to be determining. It's not going to be life or death. And the other topic that I want to share always, I don't know who is connected, okay? But I sometimes, all people like me repeat the stuff, you know, it's typical of viejo. The other topic that I want to repeat, you will have 15 questions that are non-graded. And you don't know in which moment randomly and separated, those non-graded questions are going to appear. So if you find in your test a very weird question, okay, or a very rocket science question, don't too scared. I don't know, but probably it's possible that it is a non-graded question. Why? Because they need to explore from time to time new medications that have appeared. And they need to explore if the schools are already teaching this new medication, or they need to explore, you know, special situations, okay, in the population. And they do this kind of research, okay, in all the test takers, that you are going to have necessarily 15 questions that are non-graded. And I don't know you, but in my case, they give me a certain level of confidence, because I know first that I don't need to get 100. Yeah, I need to pass. And second, some of the questions are not going to be graded. And maybe some of the questions that I found very weird, very strange, I never heard about this, maybe it is a non-graded question. No, it gives me confidence, because you say, no, it's just a test, and you know, it's a test that they are doing stuff that they know better what they're doing, and what they are testing is if I'm safe and if I have the basic knowledge. And yes, if you study your basic knowledge that has been delivered to you in the program, you need to put that in your head. It is in your books, it is in your classes, it is in, especially in your books, it is also in your practice programs, the programs that prepare you at the end. ATI, HESI, all those are very good. Kaplan, all are very good. There is the basic knowledge. If you know your basic knowledge and you learn to think, to read carefully the questions, you know you are going to be successful. So if you pass your test, as most of you are going to pass, with 75 questions, and then comes the paper pass, okay, pass, in reality you pass with 60 questions, okay? So I don't know, but in my case it gives me some relaxation, so confidence. The nursing team consisting of one RN, one LPN, and one nursing assistive personnel, or UAP. In the English, you are going to see unlicensed assistive personnel. Received report from the previous shift. At the completion of the report, it is most important, hey, prioritization, what is most important, for the registered nurse to take which action. So we have 4 actions. Assess the bowel sounds of a post-operative client. After the LPN reports, the client feels nauseated. So we have a patient after surgery that has nausea. Of course, it's pertinent to assess bowel sounds, etc., the abdomen, etc. 2, visit each client. So make your round. It's called the round. Visit each client assigned to see how the clients are. Yes. So somebody give you the shift, they told you verbally the client that you have assigned, and then you make a round, room by room, presenting yourself and seeing how the clients are. Make assignment for the members of the nursing team. You are responsible to assign patients to the LPN and patients with the EAP. And discontinue an IV for a client reporting swelling and pain in the insertion site. Okay.
Bis.
So obviously you can rule out the round because you can wait. Obviously you can rule out the administrative part because the patients go first. So I think that everybody in this question should be left between A and D. The patient that is after is surgery, that is nothing emergency, but has nausea, and you need to assess this client and do something for this client. You need to do assessment and intervention as needed. And the patient that has an infiltrated IV that is presenting, okay, symptoms of extravasation. So everybody agree that the priority is D? Yes? Okay,
Yes.
who can tell me why this is a priority?
Necrosis.
De necrosis.
There is a possibility that the medication or the substance that has been infused could be a vesicant and can produce necrosis. And even if it is a non-vesicant, it's just a IV solution, which is usually non-vesicant, the patient is in pain because that. And it is something that you can do very quick. Yes, so you can stop the harm. You can stop the harm. Okay, you can stop the harm here. Okay, and you stop the harm here. Okay, because it is harms. It is something bad what is happening, and you stop this harm. Okay, you stop this harm, and it is the priority. This is an assessment that takes a little more time, and you need to do that next. Makes sense?
That one is a safety first.
It is also an issue of safety. Very good. Okay, so I think that one in the at least in English, once you understand the question, you won't have problems. The problem is the people that don't read, like my students, and the people that are in a rush and very nervous, etc. But if you study and you understand the question, you won't have problems. Because precisely that's what I select this type of question, because are English type questions, you know, are not those sadistic questions that sometimes we find when we need to be over prepared. So I want also to present Nclex style question that goes straight forward for your knowledge and your common sense and your concept of safety. Yeah, that's why I make a selection of questions before presenting to you. So you are not so frustrated. And I'm sure that you are learning, you are reading well the question, more strategy than knowledge. The nurse is caring for a client who is 1 day post-cardiac catheterization with a stent placement. Assessment findings are blood pressure 90/60, heart rate 55, and oxygen saturation 95, which is normal, no? Saturation of oxygen 95 or more. In nasal cannula at 2 liters per minute. Which task should the nurse delegate to the UAP, to assistant personnel at this time? You have watch the client take an oral dose of aspirin, assist with a morning shower and oral care, report vital sign to the healthcare provider, obtain urine output for the past 4 hours. Which one do you think is the best activity to delegate to the CNA?
D.
Can you please, I beg you, I have a hearing problem, zero hearing problems. I cannot differentiate the vocal B from D. If you say B as in boy, D as in whatever, as in dog, it will help me a lot.
D is as in dog, professor.
D as in dog. Okay, D as in dog. Okay. Any other opinion? No? Nobody think that you know that hygiene
Assist with morning shower.
Exactly.
B, yeah.
B as in boy, no? Okay.
Yeah, as a boy.
Okay. So
As in boy.
you need to be honest with yourself that it's very possible that when you are in your Nclex, you say, no, medication is nothing to do with the CNA.
No.
And reporting to other healthcare member of the team is not CNA. So
No.
could be, those are activities that a CNA can do. So hygiene and obtaining, counting urinary output can be also done by the CNA. The CNA can go to the bag that is collecting the urine coming from the Foley and can empty this bag. This bag is empty with a graduated cylinder and can measure how much urine is there and can document in the client chart how much urine, the date, the time, and the amount of urine when empty the bag. The CNA can do that, okay? And she noticed standard precautions, okay, how to do that, okay? So it is in the scope of practice. So then you need to see, oh, I need to find a problem with either one. So obviously I need to go back to the question because something is missing here that I didn't notice. When I go back to the question, what called my attention? When I carefully read the question, what called my
pulse
attention?
rate, professor, and the blood
The
pressure.
blood pressure and the
And
heart
pulse.
rate.
Yeah.
Yes. And what is a shower? What is a shower? Let me see si ustedes se bañan. Let me see si ustedes se bañan. What is a shower?
La ducha en el baño.
So it's something that you are standing there to receive a shower, yes? It's not a bed bath, no? No? It's not a bed bath, okay? It's not
And
a
with
bed
that blood
bath.
pressure, that patient needs help.
This patient will faint, okay, in the
Yes.
shower, and then you are
If
going
the
to
nurse is not with him.
Exactly. So now you need to be honest with yourself, okay, that in the real exam, sometimes you need to slow down. You need to slow down. You need to hit the brake, okay? And probably after doing your strategies and the ruling out the stuff that can be ruled out, ¿qué pasó allí? No. You need to go back and read again, because obviously there are two possible activities that can be delegated to the CNA, but something that must be. So obviously need to be D as in dog, cannot be B as in boy. So now is demonstrating that smart people, smarter than me, knowledgeable people, probably knowing more than me, can commit mistakes in the test, especially if they don't read or go too fast. Please believe me, you will have enough time not to exaggerate, not to procrastinate, not to exaggerate, okay? But to read carefully and sometimes read twice, because some questions are so easy in English that can be answered in 30 seconds or less, and then they are going to give you left a minute and something, okay, for the other question that is more complicated, and this is going to be added, it's going to be accumulated. Rarely, very rarely, I heard of a student that run out of time in the test. And when it happens, mainly people like me that are, Balsero like me, that doesn't master the English very well and have problem with reading comprehension because the language, not because the capacity of reading or the intelligence, is because the language, which is the barrier. But majority of you have already a level that you are good reading English or perfectly master English, okay? But remember, the test is written English, is not a spoken English. Some of you are very fluent, very verbal, and very fluent in English, but then when you go to read, you read too fast and you don't pay attention to the details, okay? It is, okay, read English, okay? Read English, not spoken English. It's a big difference, okay? Very well. Home health nurse is visiting an older client living at home with chronic terminal disease. Okay. Which finding would require the nurse follow-up suspecting elder abuse? Okay, so this is something that is frequent in English. Child abuse and older people, clients abuse. Client's child asking to be designated his father's proxy. Do you think that is something that could make you suspicious that the child is abusing of the client?
No.
No, I don't think so.
I don't think so neither. Okay, so I can rule out because it's, by the contrary, is suggests that it's caring, no? It's caring. Client is left alone at home while the child and his wife go out to dinner. What do you think? Could be.
Yes.
So let's put a quotation mark here. Child has his father bank statement, so he doesn't worry about money. Suspicious.
Mhm.
Child asked the doctor to sign a DNR order for his father. Do you think that it necessarily is an evidence? Huh?
That's suspicious too.
It's suspicious too.
It's suspicious. Yeah.
Okay. Interesting that you consider this suspicious. Okay. The client has a chronic terminal disease. Okay. So a patient maybe is having advanced cancer or advanced, I don't know.
Oh my
Okay,
God.
of these three stuff, okay, I am in the test. I am in the test. Of these three stuff, what you know is the most common form of abuse of all people?
Economic.
Financial.
Yes. So
Economic.
now
Financial.
for exact financial, for knowledge, okay, for the theoretical part, for the book, we know that the most common form of elder abuse is financial. Okay, is financial. So this is something that could guide you to answer this question, because I bet that the answer to this question is C as in cat. Okay, C as in cat is the one that I'd answer if I were having that. Because the others, okay, could be suspicious, could be brings doubt, but the fact that I don't know, I can imagine here in my house at this moment, I have my mother-in-law. She's not terminal, but she has 95 years old. No? But she's you know, she goes to the kitchen, she gets her snack when she wants it. She goes there. So I don't think that necessarily, okay, if I live and allow to be alone for a while and she's sleeping, etc., is necessarily a form of abuse. So I try to imagine that it's not necessarily a form of abuse. So it's not necessarily abuse. So more between C and D. But guys, maybe you have a prejudice against this DNR stuff, okay? Because okay, I don't think, okay, that a person with chronic terminal disease, okay,
What?
requesting a DNR order, okay, is logical. Okay?
But Professor, let me see. The D is not matter of fact. You are requesting, but the another one, you hide the bank statement.
Yeah.
That is matter of fact. You really
Yes.
abuse.
Yeah, actually, exactly. Is here another? Okay, do you hear what he said? It is also in the wording something that gives you another clue. It is an action. It's not a potential. It's actual. It's not risk. You know. So definitively. Okay. So in 2 words, sometimes we need to guess, and in this, the most educated guess. In some situations, we need to guess. In this case, the most educated guess based in the knowledge that we should have is that the most common of elder abuse is not, beating the old person, is not this kind of stuff, is financial, okay, stuff. Because remember that all people have social security check, they can have saving account, retirement account, etc. Very good. Which of the following, remember that to be in hospice, if you have a chronic terminal disease, necessarily you need to be DNR, no? It's automatic. Which of the following clients should be seen first during the first 24 hours postpartum? So it is OB, no? Because it's postpartum, 24 hours. Let's see. Which client is first, a prioritization? Blood pressure, 108/60, heart rate 57. What do you think about this? What do you think
Not
about
bad,
this?
Professor.
What do you think about this? What do you think? What is your opinion?
Is in
The patient
rest
in bed.
after.
Couldn't understand well. Can you repeat? is bad.
No.
The baby in bed. Is in bed rest.
Where
Well, whatever.
where
Keep it. It's keep it.
okay, just a moment, because now there is a serious problem where it says that she is in bed rest. Where it says that.
Overthinking.
Okay, please allow me to make a surgical excision of this tumor from you, okay? So let me do that. Never add to the question what is not said in the question. What is the policy after surgery and after delivery, after birth, after delivery? The policy, early ambulation or bed rest?
Early ambulation.
Early ambulation.
So definitively, a part that is overthinking is overthinking in the wrong direction. So that's why I wanted quickly to, to make a surgery of this tumor. Okay, now, independently that she's walking, she's going to the bathroom, she needs to go to the bathroom. What do you think about this? I couldn't understand if you said it was bad, it's not serious. What you said?
Professor, I think is the person in after postpartum lose
Orthostatic
blood.
hypotension, yes, it's true.
And
After birth, all the women have orthostatic hypotension, it's true.
And the sign on hypotension is tachycardia.
Okay.
Is a lost blood.
So now she doesn't have orthostatic hypotension because then it has no tachycardia. Okay, so but what she said is true. All women after birth have the tendency to have orthostatic hypotension, which is very important because the woman, after having a baby, starts eliminating the liquid that accumulated along all the pregnancy. So has frequent diuresis, or frequent travels to the bathroom. And the travel to the bathroom can produce, syncope, dizziness, and even can fall. What is the nursing intervention in a postpartum woman, in the process of care of the woman after birth, to prevent falls due to this necessarily present orthostatic hypotension? What you do with the patient? Any idea?
Take a preparation, sit and up.
Yes. So you do teaching. And what is the teaching? If you need to get up, first sit on the border of the bed, okay? Yes, dangle your legs for a while, and then slowly stand up. Don't stand up suddenly. Isn't that what we teach patients that are starting new medications, like medication for blood pressure, or mental health medications, or any condition that could produce orthostatic hypotension, which is expected, and the patient cannot stay on bed necessarily the rest of their life for that reason? Is not what we teach the client. Okay, so in relation to postpartum, what you said is a truth, is really important to know. Women after birth have orthostatic hypotension, yes, and the risk of that is when you change position very quickly, you can faint and you can fall. Okay, but I'm not talking about this. I'm talking about this heart rate.
Professor, I have a question. Why couldn't it be C?
Can you repeat?
Could it be C? Why it couldn't be?
Could be C. Okay, no, pero I'm working in content. I'm working in knowledge, and that's why I'm working in option A. So I need you to know, because it's obviously a knowledge deficit that I'm noticing in the group, that is usual, expected, the same as the orthostatic hypotension, bradycardia in the postpartum. Okay, so in the postpartum, you are going to have certain changes in the vital signs. The temperature increases. Okay, usually is no the level of fever. No, is no more than 100.4, but the temperature increases when usually people have 97, 98. Okay, 96, 97, they have 100. The patient have bradycardia and can be as intense like this. 55, 57 is frequent, is expected, and the patient has orthostatic hypotension. Those are the expected usual changes in vital signs after having a baby. You are supposed to know that. If you didn't know that, now you know that. Okay, guys, I'm taking metoprolol and my usual heart rate is around this. Okay, and they keep the same doses. You know, is the target. Okay. Meanwhile, I am asymptomatic. It is the desired, okay, target heart rate. So this is the learning. The heart rate below 60, okay, between 50 and 60 are expected and frequent in the first day and the first hours after, okay, delivering a baby. Orthostatic hypotension and increment of the temperature. What happened with the white blood cells in this woman? The white blood cell
Will increase.
Increase.
a lot, 20,000. A lot, okay, a lot. So incorporate a group, a series of knowledge that there are changes that are very peculiar in the immediate postpartum that you need to know, okay? And the other to add is an increased coagulability, okay? It is the other to have in mind. That's why the risk of DVT increases. Guys, this blood pressure is okay. Is okay as far as the patient is asymptomatic. Okay, this blood pressure is okay. Okay, so I convince you with my presentation that this is normal. Tender and congested breast, very warm to palpation. What about this?
Is expected.
Is expected.
Is affected.
Is expected. And what is the solution of this?
Breastfeed.
Compresa tibia.
Warm compress.
Warm
and
compress.
breastfeed.
Depends. It depends. If the woman want to breastfeed, are warm.
Yes, okay.
If the woman doesn't want to breastfeed, must be cold. So please know that because it's tested. If the woman, it's called engorgement, and it's an expected process that occurs, okay, when the level of estrogen drops, when the placenta comes out, then it releases the prolactin, and now the prolactin, if you know, targets the cells of the breast to produce milk, and then the milk is accumulating there, and you feel that, and is not comfortable, and it's called engorgement. And the solution of these are several. If the woman wants to breastfeed, should place warm compresses. And the most important, what is the other most important? If the woman wants to breastfeed, what is the most important intervention that will cure, eliminate this congestion?
Support.
Put the baby to suck. Put the baby to breastfeed. It is a machine, is a, is an apparatus that immediately cures the congested breast. Yes. But if the woman doesn't want to breastfeed, the compresses, the temperature need to be cold. It's important to tell her don't touch the nipples because then you stimulate the production of more milk. Use a bra that keeps firm the breast without pressing too much, and keep cold without touching the nipples, and this way it will go. Okay, so another learning that I know is tested. Okay, so now we rule out that because it's expected. Okay, what about the last one?
Expected.
Is expected because we discussed that. We incorporate that into our knowledge. Yes. Do you imagine a postpartum woman with temperature 100.4 and white blood cell 20,000? What do you think?
Infection in some
As an
place.
infection, well,
Infection.
it's not necessarily an infection. You understand? No, it's not having an infection. So you need to depend of other elements, especially the aspect of the lochia, to decide that infection or not. So necessarily need to be C as in cat. Why C as in cat? Okay, why C as in cat is wrong.
Size of the uterus.
Yes, it's
The
soft.
Because
size,
the uterus is soft.
the size of the uterus is perfect.
Yeah,
The,
but
Yes,
Okay.
the
but
soft
it's
and
soft.
non-tender.
Is that soft?
Soft.
yes, that's what caught my attention there.
Is soft. So remember that is after 24 hours is expected the uterus to be hard, to be contracted.
Really.
Yes?
Yeah. Mhm.
No,
Okay.
no buggy, no soft. Yes. Because it's very contracted, it's tender. When you palpate, it's painful. Yes. So when the uterus relaxes, okay, relaxes is when it's not hurting, but then is the one that have the potential of bleeding is hypotonia or atonia, because remember there is a wound, there is a hole in the interior of the uterus where the placenta was inserted, where you have a lot of blood vessels that are still open, that they are closed only when the uterus contract. Okay, so take care, because it is a tricky question. You know, it's a tricky question. But notice that if we are knowledgeable, okay, and this is the important to incorporate, it is expected. We are knowledgeable about the expected findings, okay, after birth, after delivery. Uh, we can reach the answer. Very good. Which telephone message should the nurse respond first? A ver, which telephone message should the home health nurse respond first? Aquí esto está al revés. One, so we understand the question. It's a question of prioritization. It's related with a situation that is reported through phone call and requires immediate follow-up. Yes? Diabetic client controlled with insulin and reporting blood sugar 256. They don't say which type of diabetes is important. Client who recently has a transient ischemic attack. Usually
Yes, this one is the first.
Usually in Nclex, you have the complete name, and then the first time parenthesis the acronym, and then when they repeat that, they repeat the acronym. Okay. Generally, this is the policy in Nclex, but it means transient ischemic attack. Okay. What happens? What happens in transient ischemic attack?
You need to know at what moment feel the
sea,
sign.
there's a neurological deficit. Can be any.
Yeah.
Like a mini stroke.
But yes, it's
Usually appear in the morning and you start to recover during the day. Maybe at the afternoon. Yeah.
This is the one that I want you to say, that the patient recovers. I need everybody to understand that to define transient, the patient needs to recover. Okay? So this is the point. The point, no? So the patient had past tense a TIA, and now complaining of having difficulty to comb her hair. What means that?
Weakness in the
Yes, there is weakness. So there is a against and the so it is happening again.
Okay.
It's sign of the stroke.
Is the affect the one
No one is going to be a stroke. Very good. Good. Okay. Now we are speaking the same language. Client with intense nausea and vomits after receiving chemotherapy with cisplatin. Client who just received a report of an papa smear. So notice that everything needs to be attended, but cancer is not an emergency. Okay, it's not an emergency. Never cancer is an emergency unless it is compartment superior vena cava syndrome or tumor lysis syndrome. But this is not the diagnosis is not an emergency. No, this is a priority. Okay, but it's not. It is something that is expected and is something that can wait. Yes, and it is also very concerning. But it's something that can wait. Nobody is decompensated
because it's having the right now.
Yeah, but the problem, okay, of this is having a neurological deterioration. And why is important to run when somebody is having a neurological deficit? I mean, a stroke. Why is important?
Hypoxia. The time of the
What can
stroke.
be done in the most common form of stroke, that is the ischemic, the thrombotic, the one that is associated with TIA? The TIA
Thrombolysis, because the thrombolysis half the time.
There is an option of thrombolysis that
Thrombolysis, yeah,
can revert the neurological deficit.
you have 4 hours. I don't remember, Professor. Is the first 4 hours?
They are having extended to 4
6
hours.
hours.
In the no. This is for myocardial infarction. Okay, 4 hours, and before was 3 hours. Okay,
Now extended
to 4 hours. Okay, but is 4 hours is passing. Ya vamos a tener 3 horas aquí hablando basura. So,
oh no, professor, no se van las horas
it
con
is
usted.
not. It is not. It is not garbage, you know.
okay, so it is definitively very important to give priority to a client that is developing an acute stroke, because there is a possibility, there is a chance, if we're wrong, okay, of saving the client. Very good. The nurse administered the medication Megestrol. So this is a question about a medication that maybe I know, maybe I don't know, to a client admitted with HIV. So suppose that I don't have any idea what is this. So it's given to a patient with HIV. So some relation need to be. The nurse student asked what is the purpose of giving this drug. The nurse correct answer is increase CD4 lymphocyte count. Okay, this is pertinent to HIV, but it's pertinent to HIV. Prophylactic antiseptic for pneumocystis jirovecii pneumonia. It doesn't sound like an antibiotic. Okay. Appetite stimulation. Oh my goodness, ¿qué es esto? Decrease viral load. Oh, aquí me la pusieron. Here they put me easy because A and D is the same. Because if CD4 count increases, the viral load must decrease. It is a rule that is constant. Yes? Because if I have more CD4 count, is because the viral load is decreasing. If I have decreasing viral load, it's because the CD4 count is increasing. Do you agree or not?
Yes, professor.
Yes, professor.
Yes.
And I can, because it is the same.
Yes.
Okay, because I don't have any idea for what is Megestrol.
Yes, appetite stimulation.
It's que son like a hormone.
No, you are knowledgeable, but imagine that it's me that I don't know what is that, because sometimes it is a real life, it's a reality. I cannot deny the reality that sometimes could be a medication that I don't know what the medication is for, and I could then, in this case, apply strategies to find an educated guess. Of course, I'm going to memorize in my mind, Megestrol. So when I leave the test, I go running and I find, okay, in a drug guide what Megestrol is for. But there is a possibility that I don't know what Megestrol is. So we need to practice. We need to how do you say that? To practice, to rehearse is the word that I wanted to say, to rehearse the possibilities of having in our Nclex a question that we don't know directly the answer, but with the knowledge that we have. So we don't know what is Megestrol, but we know what happens in HIV. And with this knowledge that we have of HIV, I can at least eliminate 2 options. So now I increase the possibilities, okay, of guessing the right answer from 25 to 50%.
And 75, then, because the prophylactic, you know, that is antibiotic. It's the sulfa is not.
Exactly.
And that one is not a
also
zoster.
you have this knowledge, so this, I don't look like this, and then probably you guess, and if you guess this, it is the correct. Megestrol is a hormone, is a progestin like substance that is very effective and very safe to be administered to all people. And of course, in this case, in the case of HIV, is okay to stimulate appetite. Because the other stimulants, okay, like marijuana, cannabinoids, etc., are more side effects, more polemic, more contentions or control, etc. But of the most effective, okay, medication to stimulate appetite in patients with anorexia is megestrol. So you'll find a lot of cases of people with anorexia. In geriatric is super common. If you work in geriatric, I love geriatric, okay? This is my preferred field. I love geriatric. And in geriatric, you find this situation a lot. People that are healthy, are old but healthy, but then they develop anorexia. They lose totally the appetite. So this medication is very frequently prescribed, okay? The second one is the marinol, which is a cannabinoid, but megestrol is the most commonly prescribed. But
Professor,
yes, ma'am.
sorry. And in this case, the maestro is not only for the HIV people, is
For anybody who has anorexia.
Okay, thank you for taking the notes. Thank you.
Okay, because the problem is that also HIV can have these could you call ay, ¿cómo se llama eso? Cachexia, no, okay, has a syndrome that they lose a lot of weight and have anorexia. Okay. Okay.
Se le distribuye mal la grasa en el cuerpo porque la pierden.
No. It's a wasting. Okay. It's called wasting syndrome. Wasting syndrome.
Thank you.
Is the name of the syndrome that they develop. And it has to do a lot with the chronic inflammation that they have. When there is inflammation, for example, the tumoral necrosis factor, which is one of the mediators of the inflammation, the cytokines that mediate the inflammation, produce anorexia. Okay, so it's called wasting syndrome. Okay, it's called wasting syndrome. It's very, especially in patients with AIDS, no? Because nowadays, I don't know, it has changed so much. I feel lost now, guys. I was a witness of the beginning of the appearance of the HIV disease, like you are witnesses of the coronavirus 19, the COVID-19 disease. I was the witness of the HIV, and I developed a lot of experience with HIV. But then in the time when I faced this disease, nothing existed for this disease. And now it's so efficient and so simple, the treatment, that for me, HIV doesn't exist anymore. You understand? And I saw this wasting syndrome a lot, okay? But it doesn't exist anymore. Okay, people with HIV don't have anymore the stuff that I learned people with HIV had, okay? It's called wasting syndrome, okay? The word didn't come to my life. But what is important, because it's what I want to finish, is that you need to know that this is a progestin and can be prescribed to women and men. Yes? Okay, you know what's a progestin? It's a progesterone-like hormone, yes? What effects could produce in a man that need to take this medication, as an old man taking this medication, okay? What effects can produce in a man when he's receiving a feminine-like medication?
Gynecomastia.
Gynecomastia.
Yes, sir. This is important. It's not a big, girls don't think taking this, okay? You need to have the surgery, sorry. But, ¿cómo se llama? The most common question is what happens in a man taking medications, okay? Either antagonists of the testosterone or are, progestin or estrogenic like medication is gynecomastia, yes? because this is the answer. Okay, so it is the answer. Of course, in a woman, if the woman still has uterus, can produce no in the breast, but in the uterus can produce abnormal menstruation. Okay, abnormalities or metrorrhagia or abnormality in the menstruation. So don't forget megestrol. Don't forget is a progesterone, and don't forget that produce gynecomastia in men and produce menstrual problems or bleedings in women as side effect. Remember what I'm being saying, I don't know if you told you that in pharmacology for Nclex, two stuff are important. First, for what is the medication? Which one is the purpose of giving the medication? Y la prueba here is, this is a type of question that you have. For what is the medication? For appetite stimulation. Which one is the desired outcome? The patient is going to gain weight. Okay, and which side effects are important to follow up in men, gynecomastia, and in women can produce bleeding. And it's something to monitor and something to explain because, you know, it cannot be avoided. Are we good? So we learn a medication, megestrol, yes? Okay. Findings associated with Cushing disease: hypotension, hyperkalemia, psychosis, alopecia. Of these four items, which one is found in Cushing? Let's start ruling out. Hypotension. What we have in Cushing? Hypotension or hypertension?
Hypertension.
Hypertension. So I rule out that. We have hypertension in Cushing because the cortisol and the aldosterone makes the client retain sodium and water. And when sodium and water is retained, the blood pressure goes up. So also edema is expected. Okay, what do we expect in Cushing? Hyperkalemia or hypokalemia?
Hypokalemia.
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 Hypokalemia. Because remember that cortisol and aldosterone tells the kidney, sodium and water for me. Keep it for me. Potassium for the toilet. So because potassium go to the toilet, then the patient develop hypokalemia. The one that have hyperkalemia and hypotension is the Addison's, not the Cushing. Okay, now we are left with between psychosis and alopecia. What do you know about alopecia in Cushing?
Yes.
Okay, the alopecia is more characteristic of the hypothyroidism. Okay, and of course the androgenic hyperalopecia for the testosterone, but hypothyroidism is the most associated with alopecia. You know that in Cushing the people have hirsutism.
Hirsutismo.
You know what is hirsutism? Que te pone pelúa, que te salen bigote, that you develop mustache.
En la quija.
En la quija y en everywhere. Okay, hirsutism. So hirsutism, okay, is more related with Cushing than alopecia. Okay, so alopecia, alopecia can be found in hypothyroidism. Loss of hair is found in hypothyroidism, but not in Cushing. And so need to be psychosis. The patient with Cushing develop psychosis.
Yes.
Yes.
Yes. We uppercase. Okay, why? Yes. Even guys, when you have patients that for A, B, or C reason, lupus, transplant, whatever, asthma, receive high doses of prednisone, of exogenous glucocorticoids, you'll see that the patient can become cuckoo, can become, mental altered. So please have in mind that one of the possible alterations that you can see in the toxicity of the glucocorticoid is psychiatric problems. So something that we are learning, no? Psychiatric problems are common in Cushing. Okay, common in Cushing. Okay, those are very simple to review content. Okay, 2-year-old child diet includes beef, chicken, cheese, legumes, green vegetable, and 38 ounces of milk per day. What nutritional disbalance can this child have? Calcium, phosphorus, iron, or B12 vitamin?
Iron.
Why?
Because she drink a lot of milk.
Is drinking too much milk.
Too
And how do you
much
call this
milk.
anemia? How do you call this anemia? Milk, milk anemia.
Anemia.
Milk anemia. I know it's a hypochromic microcytic anemia, it's a iron deficient anemia. Those are the names of them. Pero people call that the milk anemia.
No more than
So
24 ounce per day.
24 is too little. 4 por 32, 32.
32.
Okay.
4 cups. 4 cups. 4 cups. 4 vasitos de leche. 4 cups.
Yeah.
Okay, and each cup are has 8 ounces. 4 por 8, 32. Yeah, 32.
Thank you.
The maximum. This is the maximum. Okay, the maximum. Okay, so guys, the milk interferes the absorption of iron, and toddlers, it is a toddler, have the sweet tooth for the lactose, the taste of the milk, and frequently they want, especially if they have the bad habit of drinking bottle, because it is like a pleasure, no? It's like a smoking, no? It's an oral gratification, and then if they drink milk with the food, with the beef, chicken, cheese, legumes, etc., that are so rich in iron, then the milk will interfere in the absorption of the iron, contained by these excellent sources of iron that are mentioned here. So good. The nurse administered the drug acarbose. Okay, so another question of pharmacology. Acarbose.
Le salió una amiga de nosotros, profesor.
A is no. Carbose.
Yes. Nclex.
Carbose sounds like carbohydrate. Okay. Acarbose. Okay. So acarbose. The nurse knows this drug is monitored for the following side effects. Cellular apply. Okay, so those questions that apply, or you know or you don't know, it's very difficult to develop strategies here. It's very difficult to use strategies in cellular apply, because cellular apply is yes or not. So the only thing that is left to you is to learn what is acarbose or acarbose. It is a medication. When you eat sugar, sucrose, saccharose, or you consume fructose or lactose, those are polysaccharides, okay, and need to be transformed in disaccharide that has 2 molecules joined by a link. Yes, and then they are disaccharidase, like the alpha glucosidase, that breaks this link, releasing the molecule of glucose, and then the molecule of glucose can be absorbed. The intestine, the walls of the intestine only can absorb the molecule of glucose. Of all these sugars that you consume, you need to, at the end, in the process of digestion inside your intestine, you need to transform the polysaccharides in disaccharides, and the disaccharides in molecule of glucose. So there is a medication that can inhibit, block the enzyme, the scissors that break the link of these 2 disaccharides and prevent the formation of the molecule of glucose, that is the one that can be absorbed. If this happens, then the glucose cannot be absorbed. And the consequence is going to be that the amount of glucose in the blood, the amount of glucose that is absorbed, is not passing from the intestine to the blood. And it could be good to whom? To a diabetic client. So this medication, acarbose, okay, is used in the treatment of the diabetes, type 2 diabetes, of course, okay? Is an adjuvant or something that helps in the treatment of diabetes. It's clear, no? Okay, but now, knowing that in the intestine you have bacteria, normal flora, you have bacteria there, now you have a sugar that is not absorbed. It's a sugar that arrives to the colon where you have all these bacteria, and they start fermenting this sugar. They say, hey, vengan, party, okay? They free food here, okay? Free donuts, okay? And they start digesting those sugars that should be absorbed, okay, and not arriving to the colon. And now what you expect to have there? A lot of gas produced, a lot of, of osmotic activity there. So those are the consequences of that, okay? So having this explanation of the mechanism of action and the possible side effects, if you were having this question, what side effects you need to monitor? Hypoglycemia, yes or not?
Yes.
Yes, because we said we were producing a blockage in the absorption of glucose. Diarrhea, yes or not?
Yes.
Yeah.
Yes.
Yes, because when you
Yes.
have the molecules of sugar suck water, are osmotically active. That's why when a diabetic have a molecule of sugar in the urine, the patient is peeing so much water. Why? Because this molecule is sucking, is pulling water from the body. Is the polyuria, because the osmotic diuresis, yes? But the same happens in the intestine. Oh Lord, the presence of this molecule, the presence of this molecule in the intestine, pulls water, and then you have a lot of water in your poo, you have diarrhea. Nephrotoxicity, no, no, it is a distractor. Malabsorption,
Yes.
yes, the mechanism of action of the medication is to, on purpose, inducing malabsorption. Bloating, gas,
Yes.
aventamiento.
Yes.
Of course, because you have a lot of gas produced there. Are we good? So we learned for some of us, we learned two medication today that are not the most commonly presented in class. Megase, because in class we cannot present everything. Some need to be learned by yourself, and it happens in the best Harvard in nursing school. We need to learn a lot with the book and practicing questions. And acarbose or acarbose, yes. So we learn the two medication. We learn how they work, for what they are, and the possible side effect that they can have. And this is what happens when you practice question. When you find something that you don't know, you learn that. That's it, in case that you don't know that. The nurse is administering the order treatment to a client with COPD decompensated, which ABG's finding tell the nurse that the client is improving. Okay, so a patient with COPD, what means that the client is improving with the treatment? Let me see. PCO2 changes from 30 to 45. So the CO2 increases. Sounds logical.
No.
No.
Because the idea of the treatment of COPD, the CO2 decreases, no? PO2 changes from 82 to 98.
No.
Yes.
Could be.
Will be.
Mm.
PCO2 changes from 65 to 55.
No.
It is improving or is deteriorating?
Deteriorating.
It's
Deteriorating.
if you go from 65 to
It's
55,
improved,
Okay,
but,
improved.
the number is bad.
Improve.
the
It's
number,
too high.
pero they are
But you improve.
is
Improve,
improving.
improve. Yes.
Again, is improving. Okay, is improving. Not yet the desired target.
Yeah.
And the pH change from
It's deteriorated.
it is deteriorating.
Deteriorating.
So it is not.
Yeah.
So obviously is between B and C. What you know in the two situations, which one is going to be better? B or C?
C.
Sí.
C.
¿Por qué no B? Why not B?
Professor, because a patient with COPD is a chronic obstructive pulmonary disease.
Mm.
Usually have 80, 89,
80 to 90.
90.
You normalize
Mhm.
the oxygen. If you normalize the oxygen and at this high level, what is going to happen? Stop
Hypoxia.
breathing.
Stop.
Stop breathing. No, it has hyperoxia.
Yeah.
Has hyperoxia, but then the only drive, the only stimulus that they have to breathe is a mild hypoxemia. If you elevate too much in a patient, unless the patient is intubated, no? But they don't say here this intubated. And if you elevate too much the level of oxygen in a patient, the patient will stop breathing. So in the moment that you, for A, B, or C intervention, usually administration of oxygen, you are giving so much oxygen that the oxygen in the blood goes so high, like 98, millimeters of mercury, the patient will deteriorate instead of improving. So the patient was okay with 82. When it's moved to 98, the patient is deteriorating, is going to go to worse. So correct. The patient is improving in C as in cat. I know that still 55 is not perfect, is not completely good, but is moving from 65 to 55. That is an improvement. Is an improvement. Yes. The ¿cómo se llama? The pH becoming more acid is deterioration. Yes. And elevation of the CO2 is deterioration. So the main purpose of the treatment in COPD is improvement of the level of high CO2 without producing hyperoxia, because in this case they stop breathing. So it is playing with the possible combination. Okay. The nurse is giving instruction to the CNA to assist with the care of a client who went to lumbar tap 1 hour before. Lumbar tap, lumbar puncture, 1 hour before. CNA is going to take care of this client. Which of the following instruction is appropriate for this client? Keep the client flat on bed with only a thin pillow under the head. Keep the client NPO until bowel sound return to normal. Change from supine to lateral position every 2 hours using the lock roll technique. Place a bedside commode near the client bed in case she or he needs to have a bowel movement. Okay, let me discuss what we know about the care of the lumbar tap. The most important is to prevent the headache. The patient needs to be kept flat for several hours until the liquid is reproduced. Okay, so we can immediately rule out bedside commode, because bedside commode we know it's a chair that the patient will get up and go to the chair. Yeah, we agree with that, no? We rule out that. Yes.
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 And there is no need to be
Not
MPO neither before the lumbar tap nor after the lumbar tap. Please pay attention to what I said, because I saw it in a Nclex question. There is not need to be NPO, empty stomach, nothing per out, before a lumbar tap, unless after. You understand? There is no need of any preparation for lumbar tap. You can have in this moment suspicions of meningitis, and you can have a coffee, okay, half an hour before, and they can do the lumbar tap. You understand? So there is no need of this. So we rule out that. Okay, so need to be between A and C. Okay, so A and C, because what is the problem with C from your point of view? What is the problem of C?
Moving constantly the patient. I mean,
Say
I
again?
think
Say again?
like moving constantly the patient, I think like is going to produce a lot of pain, right? That's what
No,
it's
if
okay.
you use the log roll
Log roll technique.
No, if you use the log roll technique. Remember that if you are spending more than 2 hours over your sacrum, you can develop a bed sore. Theoretically, you should not be more than 2 hours in the same position. Yeah. So the patient, as far as the head is at the same level of the body, can be turned, okay, to the lateral position, as far the lock roll technique is used. Okay, because the lock roll technique is the technique to avoid twisting the spine in any surgery, in any fracture, in any, ¿cómo se llama? Procedure that had to do with the spine. Okay? So I support that the patient cannot be more than 2 hours supine. Need to be changed to lateral position. Okay, and the lock roll technique is correct. So, C, I don't see the critique. The only problem that I see in A is that the
pillow.
the book say that pillows are not used. When they are supine, is without pillow. And the word thin is a trap. And I saw that in Nclex. Because then I know a thin pillow is nothing. A thin pillow will elevate a little the head and then can produce the headache. Yes. So they say in the book that when the patient is supine, no pillow, neither thin or thick. And if I were in my Nclex, I go to C because I don't see any anything to correct here because it is correct. So this is my opinion. This is what I do, but it's not because my opinion. It's because what I read in the book, what I learned from the book. That in the book say that when the patient has a lumbar tap, is kept supine on bed without pillow. But after 2 hours, the patient is going to last more than 2 hours in this position. Need to be changed the position, but using the lock roll technique. And this is another question that I seen. Okay, what technique you use to change position for patient after spine surgery, after lumbar tap, and the answer is lock roll technique.
Yeah, makes sense.
Okay, infection control appropriate to take in client hospitalized with adenovirus infections. Se la pusieron difícil. Who knows what means spider?
Yeah.
Ok, se lo tienen que aprender. And the last is placed in this position. So, S, streptococcus, strep throat, or scarlet fever. P, pneumonia and pertussis. Pertussis, whooping cough. I, influenza. D, diphtheria. E, epiglottitis. R, se me fue la mente. ¿Qué cosa es lo que es? Rubella. M, meningitis and mumps. Okay. Rubella. Se me fue la mente, señores. Me está pegando la edad. And what means AN?
Adenovirus.
Adenovirus. Just in case you have not noticed that, because sometimes people study don't realize that. Okay, adenovirus. Okay, adenovirus. So the answer is
Droplet.
Droplet precaution. But you know, I want to introduce something. The CDC says that is droplet and contact. So influenza, and adenovirus is droplet plus contact.
Okay.
Plus contact. Have you heard recently about adenovirus? Any problem with adenovirus recently in the news? No? Any?
No.
Ay, ustedes no viven en esta. Ustedes viven bajo una piedra.
Only the monkey rubiola.
No, the hepatitis in
Esa, quién tenía que ser. La hepatitis.
the acute hepatitis that is killing a lot of
you know, and the transplant, the liver transplant. Have you heard that in many parts in England, in Europe, in Australia, here in America, cases of hepatitis, fulminant hepatitis in children. and a lot, almost 20% have required transplant, liver transplant. And the only thing that they found positive is the adenovirus. Usually adenovirus produces common cold. El catarro común, no el flu. Common cold. Also can produce pink eye. No? They sometimes can be serious, can produce viral pneumonia. But in this case, is associated something new. It's a new emergent, okay, disease. Those hepatitis in children, okay. And the only thing that they found, they are not sure they are related, but the only thing that all them have been positive for adenovirus. Okay, guys, this is what I have for today for you. I hope that it helped you something, and see you next Monday.
Thank you very much.
Thank you, Professor.
Okay, bye-bye.
Thank you, Professor.
Thank you
God
so
bless
much,
you, and
Professor.
continue
Thank you,
to
Profe.
study. That is the secret of being successful, okay?
Por eso no vemos la noticia.
Excuse me.
¡Ay, mentirosa! Pareció la nariz.
Está buena esa. Muy buena el abuso.
Bye-bye.
Bye.
Bye, Professor.
I'm sorry, Professor, are you there?
Yes, I'm here.
Professor, I don't have the notes, the Spider-Man. I never been in